Okay, so we're live. Hopefully. We'll see if it records more than 10 seconds this week. So welcome everybody to our weekly spinal workshop. Tonight's topic is one that impacts a lot of people, and it's about arthritis. You made it. So for everybody on Facebook, I'm Dr. Ashley Kempner, and we have a packed house, which is always exciting to see. We have some guests here this evening as well, which is also very exciting. So I offer, if you have any questions along the way, please let me know, because we'd like to answer questions here. And if you're thinking it, chances are someone else is thinking it too. So don't keep your questions to yourself. Now for this evening, we're going to start with a trivia challenge. Okay? I have no prizes. I'm sorry. I'll give you a hug. So these are questions that we're going to answer through tonight's workshop. And so the first one is, what is arthritis? So you can think about your, do you have an idea?
Joint
inflammation.
That's the word. Itis is inflammation.
Itis, inflammation, right? So there's inflammation of a joint.
Pain, breakdown.
Pain, breakdown. So there's some symptoms that we associate when we hear that word. So who do you know who suffers with arthritis? So some of you will raise your hands. A lot of nodding. So that's wasn't meant to be personal, but think outside of yourself. Do you have anyone in your life that maybe has said, I have arthritis?
My mom thinks that her little wobble, she says it's because of arthritis in her hip.
Okay, so people say they have it. It is something that typically needs a certain method of diagnosis, but a lot of people assume it's normal with age. And then, what are the most common types? We're going to talk about the most common type of arthritis tonight. And does anyone know what that is? Osteo. Yes, that's the fancy name for it. Osteoarthritis or degenerative joint disease. And then, why does it happen? There's a lot of theories out there.
Uncorrected subluxation.
Oh, there we go. That's one. A lot of intelligent people here. What are the symptoms? You guys kind of shouted those out when we first got started. And then the final question is here, can it be fixed? We hope so. We hope so.
That's why we're here.
That's what we're here to find out, right? We're here to answer a very important question. So we're going to answer these questions as we go along this evening. I'm going to give you some information because this is a topic that people need to know about.
Oh, yes.
I mean, chances are, how many of you here have seen x-rays of any joint in your body?
Oh, yes.
Right? At some point. So chances are, if you saw that and you had a doctor read it for you, they told you whether or not there was a chance you had arthritis in that joint. And so we're going to talk about, again, why that happens and everything you can feel with it. So what is it? Inflammation. Woo, winners. You guys are smart. That itis on there. So it's inflammation of more than one joint. And now I'm going to say I don't agree with this in its entirety. That gets worse with age. That's part of this definition. This is not my definition. This is from the Mayo Clinic. But I disagree with that it gets worse with age because I believe that's an option. And the typical medical treatment's goal is to reduce symptoms and improve quality of life.
So the theory of worse with age, not necessarily because you're older, but because of prolonged in repair. Like with our subluxations, if you have them, it's something that progressively gets worse if you don't get corrective. So maybe the arthritis may fall into that category.
Right now, the theory is that everyone gets arthritis, right? They tell you it's normal. That's inaccurate, which is why I have a hard time. I agree that it's inflammation of more than one joint, or a joint, or more than one. I agree with that. The itis, the inflammation, that is 100% true. I disagree that it has to get worse with age. I disagree that it's a normal part of the aging process.
How about the cause and pain?
We'll talk about that.
Oh, because you I feel pain.
And another thing that bothers me is that typical medical treatment's goal is to reduce symptoms.
True.
But if we're only addressing the symptoms, what are we doing to stop the progression?
Absolutely nothing.
We're masking, right? So I agree with the fact that if we are treating the symptoms, so we continue going on the things we're doing in our life that are causing the problem but never addressing the cause, it will get worse with age.
Yes.
That is 100% true. However, I disagree with a lot of this. We don't want that. No. No way. So what causes it? What actually causes that itis, that inflammation?
Injury.
Injury?
You said,
Subluxation?
doctors say hereditary, genetics, all that other stuff.
Breakdown of connective tissue.
Breakdown of connective tissue, genetics. There's a lot of theories out there as to, there are some forms of arthritis that are genetically linked. As far as the most common type, which you've already had answered, thank you, osteoarthritis is not genetic.
Okay.
It is hereditary in the fact that we move like our family moves. So, learn behaviors, absolutely. So does anyone here have a family tradition that they've passed on? Or had passed on? And you're like, it could be something good, like for the holidays.
Sure,
Say,
sure.
yeah, we decorate our trees a certain way, or we do certain things certain times of year. And one of my favorite, this is totally squirreling, but that's okay. So one of my favorite stories is about this. It's about a family, and they're getting ready to have their Christmas dinner. And every year for Christmas, when they're making the roast, the women go in the kitchen, they make the roast, they cut off the two ends of the roast before they prepare it and put it in the oven. And there's a family that was gathering, and all these generations of people, and the youngest little girl there, who's like 6 or 7, said to her mom, she said, "Mom, why do you cut off the ends of the roast?" And she said, "You know what? I don't know why, but my mom's always done it, so let's go ask her. She's here." I said, "Okay, Grandma, why do you cut off the ends of the roast?" And Grandma said, "You know what? My mom just always did it that way, so she's here. Let's go ahead and ask her." So great grandma, why do we cut off the ends of the roast? So it can fit in the pan. I never had a pan big enough. So there are things that we can see how things get passed on in our family that we may not necessarily think, like you wouldn't think, oh, that's genetic, but it got passed on.
The pants got bigger, but they kept cutting off the ends.
So yep. So there's things in our life that get passed on, but they're not genetic. So if you talk about my personal medical history, I actually was diagnosed with arthritis in my left hip when I was in chiropractic school. They did an X-ray, and they found I had diminished joint height in my hip, and they said, "You have arthritis." And so I talked to my family about it. My dad, my last name was Parmarter, and they said, "Oh, it's just a Parmarter. We all have bad left hips."
Wow.
Turns out we just all move the same way.
Mm-hmm.
So since getting adjusted and changing some lifestyle habits, I no longer have left hip issues. And my father, who now gets adjusted, thank God, no longer has those issues, and not to the degree that he did. So it is possible to say, that wasn't actually genetic. It was just something that I hereditarily picked up, and that I intend to break that habit with my children. So, woo, that's right. So what causes it? So we talked about this, osteoarthritis. So this actually, the most common type is from wear and tear. Osteoarthritis. So this is a joint that has just worn out over time, repetitive use. I would say improper repetitive use. Okay? So the second most common type is rheumatoid arthritis. We're not really going to focus on that. That one does have a genetic component to it. It can still be addressed in similar manners. That can still be helped. That we're going to talk about. But this is the most common type, also known as degenerative joint disease. So when you have degenerative joint disease or osteoarthritis, you're going to have impacts of the hard bone and the soft tissue of the joint, so the cartilage. If you're talking about the spine, it's going to impact the joints of the spine, back here, and the discs in between. Most common type. So why does it happen? We talked about that. It's repetitive use of a joint that's not being used properly, or it's misaligned. So you can have a joint that's been damaged either through injury, or it could be repetitive use. Our society is really good at repetitive activities nowadays. It could be sitting in front of a computer, texting on your Kindle, whatever it is. We don't do all the big movements that we used to do. But if you're misaligned, it's going to cause your joints to wear out unevenly. Think about the alignment of your car. If the alignment on your car is bad, say you have a habit where you hit the curb significantly. You see my car. I have a habit. I tend to tap curbs. It's just a little tap. People in the parking garage, they paint those curbs yellow for me. and you know that on a fresh day they painted because my car's in the parking garage with yellow paint on the tire. So I do it every time. I always apologize. I'm sorry. But so if you think about my car and it's misaligned, if I continue to drive it that way, what happens to the tires? They wear out unevenly, so I have to replace them more frequently. Even rotating them is not going to make that big of a difference if that misalignment is still there. The same thing is true of your joints. So what do we know that advances the breakdown, that causes it to happen faster, that makes people think that it's normal to happen with age?
When they don't treat it on the onset, when we not treat the onset.
When we don't address the cause, right? We don't address it right away. Repetition, continuing to do the same thing over and over again, expecting different results. The definition of insanity. Absolutely. Joints. Yes.
Many things.
So there's a lot of things that we can do unknowingly. Come on in. We've got a chair right in the back for you. So there are things that we can absolutely do on a daily basis that we may not even realize are advancing this process and making it happen at a higher rate, which is why it's considered to be common and normal. Which is why it's considered to happen normally now, earlier in life. So the usual age of onset used to be what?
50s, 50s, 60s?
85.
Oh, wow.
Used to be 85. Now, 50s and 60s. We're seeing it more in people in their 40s and 30s. Remember, there was a stat that I shared at a different workshop by the year 2032, what they're anticipating. 18 years old is going to be the normal age for arthritis onset.
That's awful.
How does that make sense? Just think about that. Something that used to be normal when we were 85 is now normal when we're 18. That doesn't make
Our
sense.
life expectancy, though it has increased, our quality of life has decreased. Because previously, it was average age was 45, 50. Like for a person to see past 50 was not normal. Now to see into the 80s is expected, but you got more health issues at a younger age, so you're not likely to be able to live a healthy older life.
Right, and to be truthful and honest, we're actually seeing a decrease in our life expectancy in our country. We're actually seeing kids being born today are not expected to live as long as their parents. How is that okay? These are not things that are okay. These are not things that are normal. So it's a big deal. And so arthritis, we want to change the way people perceive the idea that arthritis is normal. So what does it look like? So these are just some different pictures for you to see what it can look like in the spine or the knee, the hip joints. I like this one up here. It's very Halloween-y. So we have inflammation, that joint, that red in there is showing inflammation. And then we have loss of that soft tissue that's meant to cushion the joint. So this is what it can look like when you look at it on an x-ray. You can see how the joints become jagged. And there's a lot more extra bone there. Now that extra bone is actually a very intelligent response by your body. We have this thing called innate intelligence that lives inside of us that says, I know how to take care of myself and heal. So if you have repetitive stress and inflammation in a joint, your body intelligently says, I need to put more bone down to make this stronger. Because bone is the strongest substance in our body.
That's why the knuckles start to get misshapen.
Yes, so that's why we start to see joints with arthritis in it become enlarged and misshapen, because your body's intelligently trying to make it stronger. And it does that through new bone. So, absolutely. Now, in your spine, I know you have seen this a lot. I show these pictures a lot because it's important for you to realize why it's happening and what it can look like. So, this is our normal. Who remembers what the normal is supposed to look like? Curve.
Space.
Yes, curve and space. Nice disc spaces in there. That's beautiful. Space for the joint, for the nerves to come out between the joints. It's nice. Then we have our phase 1. There's no arthritis in phase 1, right? This person has straightening of the curve. So here we're starting to see compression of nerve impulses, body not communicating as well. And the joints are definitely working harder here, but they're not quite broken down yet. Phase 2, this is when the disc disease starts happening. We start seeing breakdown of the disc. We start losing that soft tissue. So this is most definitely a sign of inflammation and a long-standing problem. And then our phase 3, this is fusion. This is a lot of arthritis growing together. And again, it fuses. Your body, it can actually fuse itself to try to stabilize and make it stronger. Not ideal. The body is designed to move. Our spine is designed to move. It's how we actually feed our brain, is the movement of our spine. So this is not normal. This should not be happening until you're, well, it shouldn't be happening at all, but how old should you be before you have any signs of wear and tear in your body if you're using it properly?
125.
We're going to break it. 125. Right in the middle. Say 100 and 150, 125. So, absolutely. So if you maintain your spine in this form, it does not break down. And that's important to remember. This is normal. This is not. This is sad and sick. And so we want people to understand that you can absolutely change the pattern that's happening in your body. So the symptoms, we talked about this, right? So what was the first thing you said when we talked about arthritis? What would people experience? Pain.
Loss of movement.
Loss of movement, stiffness.
Inflammation.
Absolutely. So yeah, we have the pain there, we have the stiffness, and absolutely we have swelling. So swelling is another intelligent response of your body to try to bring more nutrients to the area. So your body says, this is damaged, you need to heal it. It heals it through swelling, through inflammation. It's supposed to be a very short-lived phenomenon that happens. The problem is, if you're not addressing the underlying cause, what happens?
It stays longer. The body's kind of continually trying to heal what's still damaged.
Right.
If you don't fix it, it's still trying to. For babies.
So, exactly. So your body's going to continue to break down. You're going to be using energy to try to heal something, but you're not addressing the cause of why it's happening. So it continues to break down, the inflammation continues, the pain continues, and eventually you get to that point of, like go back here, the fusion. Once something is fused like that, it typically doesn't hurt in that area of fusion because the body's glued it together and said, I did everything I could do. However, then the problem spreads out to the other areas making up for that lack of motion. So it's a compounding problem. I hear heavy sighs, don't be frustrated. There is hope, I promise you. We would not just sit up here and give you sad information. So, big question of the evening. Can it be fixed?
Yes, depending on the stage.
Depending on the stage, sort of.
Damage cannot be done.
Damage cannot be undone.
Depending on your age or exactly what.
The stage of damage.
Okay.
And once you get to stage 4, once it's fused, it's locked, but you can improve the quality of life. If it's at stage 2 or 3, you can potentially stop it from getting worse. You can't necessarily take it back to new.
And the key word is improved.
Right.
I don't know if anything at a certain point can be fixed, but much improvement.
Yeah, quality of
Because
life.
I'm greatly improved. Yeah, I am. So I feel so much better. So yes, improve. Absolutely.
Improve quality of life.
Absolutely. Yes.
So, yes.
Is yours fixed?
Is mine fixed? Is my hip better? Absolutely. I actually have some x-rays I'm going to show you this evening.
Awesome.
So those are always exciting. And for those of you who know, we have our x-ray wow board around the side. These are real live people we've taken x-rays of. Before, during, and we'll do after when they're done with their care plans. And so I've got a couple of those to show you as well this evening. But these are people who were actually seeing improvement. So I absolutely agree with you. The stage of intervention makes all the difference. Because if you have someone coming in, and we tell people this, if you come in and you're in stage 3, we have to be honest and say we cannot correct that. We can improve your quality of life. We can decrease your dependence on pain medication, because everyone knows pain medication is not ideal in our bodies. It breaks us down even faster. It causes us to cover up the symptoms, so we continue using our bodies improperly, so the problem continues. But there's definitely hope. So, the common, I'm going to say that these are treatments. I'm not going to spend time on that first one, medication and surgery. If you want to know that kind of stuff, turn on cable TV. Because honestly, there's no real benefit to covering up your symptoms, and there's no real benefit to cutting things out of your body that were designed to be there. So that's something, if you want to look more into that, that is your choice. I'm not going to waste my breath on it because just turn on the cable. Supplements. So you can actually support your body. So thinking about those joints that are inflamed, if you're feeding your body what it needs to have in those joints, it won't use up what's in the joint as quickly. So you can actually slow that process down by giving yourself proper supplements. So glucosamine is a fantastic supplement that if you have arthritis, if you have someone tell you that you have diminished cartilage somewhere in your body, you should be taking this on a daily basis. What I will say about glucosamine, all supplements, is that quality matters. So if you go to a store and someone says you have to take this glucosamine supplement and you have to take it for 8 weeks before you're going to notice a difference, it is a low quality supplement. It doesn't have to build up in your body that long.
How long is the expected average for quality?
If for high quality, we're looking at people notice a difference 1.5 to 2 weeks using it. You're taking the right amount. So you want to make sure that you're getting high quality for that. Also, calcium and magnesium, supporting your joints. So for women, we have a different bone issue, and I think we have a workshop on that coming up as we age. That's osteoporosis. So what can happen is when your body says, I need more strong bone here, it's going to take it from somewhere else. So it's important to make sure that you're having a balance of calcium and magnesium in your body, regardless of your gender, but women, we do need more, to make sure that your joints are being properly supported. Because again, your body's going to burn through what's ever in those joints. So if you're supplying it with the proper building blocks to repair it properly, you're going to have much better results. All right, lifestyle changes. So yoga and Tai Chi. Has anyone done these?
Not effectively, but they're fun trying.
They're fun trying. Okay. So these are really great controlled movements, breathing. Good ways to make sure that if your muscles are being impacted, you can stretch them out and balance them that way. So that's a really good way to get nutrients into your joints as well. Because part of the reason your joints will break down is they're not being properly fed, because they're not moving the way they should be. Also have massage therapy, muscle work. That's a good way, again, to take the pressure off your joints. So if your body is constantly compensating because you have misalignments in your spine or elsewhere in your body, your muscles are probably going to feel tight and sore. So having someone work on those muscles to help get toxins out, help them stretch out, can actually help to, again, feed the joints properly. It's not going to fix the underlying alignment issue, but it's going to help things progress a lot faster, especially if you're incorporating other methods like chiropractic care with it to address that.
It kind of decreases what your body has to fight to do if you can help it properly.
Exactly. So if you're helping your body along the way, so you're taking proper supplements, you're moving properly, it's going to help, right? Rather than sitting there and saying, I'm just going to keep doing what I'm doing and expect different results, which is insanity. So, anti-inflammatory diet. This is really, really, really important. If you have pain anywhere in your body, you need to be on anti-inflammatory diet. That's joints. People who have joint issues, obviously, if you go and you eat crappy food, you're going to feel crappy. You're going to feel it in your joints. But this can be said for gut issues, nerve issues. There's any inflammation excessive in your body that's causing you pain, which is your body's way of saying there's a problem. Eating an anti-inflammatory diet will decrease your body's inflammation and allow you to actually heal properly. And then, of course, chiropractic care. Because why wouldn't I mention that in a class about proper joint alignment? So, somebody made the comment earlier that cracking your joints causes arthritis, right? That's somewhat true, somewhat of a misconception. So when it comes to your hands and your fingers, those are what we call flat joints. So it's actually flat bone on flat bone. So that one, but if you feel you must pop your knuckles, please pull straight out. That's the only way to really do that properly. Now, your spine, on the other hand, all of these lovely joints are at slightly different angles. So if you're someone who is grabbing your head and cranking your neck to the side, and then to the other side, that is not specific, that is not local, that is damaging. So if you know someone who is cracking their own spine, please tell them to stop. What's actually happening, if they have misalignments in their spine, misalignments like subluxation, it moves, it gets stuck there, and then when they're trying to crack their own body, what's happening is you have joints above and below it that are moving excessively because these ones are stuck. So these move excessively. When they crack it, they move these more, but not the ones that are actually stuck. So they're actually causing breakdown and inflammation to happen at a higher rate below the issue or above the issue that's stuck.
So they're extending the discomfort they're having.
Exactly. So that's why most people who come in and they say, oh yeah, I crack my neck 10 times a day. No. The reason they feel like they need to do that is the body says, I need to stabilize this. This isn't strong. And so it puts down scar tissue. Scar tissue feels tight and stiff. So if they're then, retching their spine one way or another, they're ripping that scar tissue. The body says, okay, I can move. That movement feels good for a second. But then the body says, oh wait, no, inflammation. This is damage now. Puts down more scar tissue, and they continue to cycle. So it's actually very, very damaging. With a chiropractic adjustment, what we do is we actually find those very specific pinpoint areas that are not moving properly. We identify the direction of correction the joint actually needs, and that's what your body gets when you lay on the table. We don't adjust what doesn't need to be adjusted, we only adjust what does need to be taken care of. So we would only adjust the ones that are actually subluxated, we would not adjust the ones that are moving excessively to make up for that lack of motion.
So in short, can we ever self-adjust back pain?
Nope.
No.
I can't adjust myself, Dr. Steve can't adjust himself. This is something that only a chiropractor can do. So, but it's important to make sure that you're taking care of your body. Just like you get your teeth cleaned, hopefully all of you do that professionally, at least twice a year, and a couple times a day yourself, but we want to make sure that you're taking care of that, but your spine has to be taken care of by someone who is specifically addressing what needs to be addressed. That does not mean having someone walk on your back, having someone pick you up and give you a hug. That is not the same thing as a chiropractic adjustment. Alrighty, so going on with our treatments here. So no matter what phase you're in, if you want to have a difference in your body, you have to be proactive and start today. For those of you with children at home, if you don't want to see them develop osteoarthritis, if you don't want to have them be that 18-year-old with arthritis in their spine, you have to teach them today what they need to avoid or do to protect their bodies. Because I can tell you, nothing breaks my heart more than going out to a restaurant and seeing mom, dad, and their kids all on their own little electronic devices. Nobody's looking up and everybody's necks are like this. So they're teaching your children that that's proper movement. I guarantee you those kids will be in this office or some chiropractic office or even a neurologist office with chronic migraines. Because that's what happens. So, if not sometime in the near future, eventually. So you have to be proactive and you have to make changes starting today. So if you were someone who says, well, I already have arthritis in my spine and I just have to deal with it the rest of my life because that's what my doctor said, I'm sorry. Enjoy your pity party. The fact of the matter is you have more power than you're allowing yourself to believe, and by taking on some of those lifestyle choices, you can absolutely change the way your body's working and reverse that breakdown process. It does not have to continue on that path. You have to move, you have to eat, and you have to think life. So you can't be sitting there thinking, or me, I have to deal with this forever. Just give me another medication to cover up the symptom, my body continues breaking down. You can change it, but you have to make a commitment. And I don't know about you guys, but for me, I have to live with myself every day. So I want to make sure that I'm taking care of myself. This is the one house I get to live in. You are in the one house you get to live in. You better take care of it. All right, so I want to show you these x-rays because this is someone who, this is the low back. I have two low backs to show you this evening. So this is the low back. This one was taken, let me see here. Oh, I only have the one. Okay. This is was taken in 2014. This was taken in 2016. So what signs in this spine do you see would be indicative of osteoarthritis?
That lower one is pinched down and the curve is kind of odd.
Yeah, the curve is wrong. That disc is definitely compressed.
Yeah.
And you can see how it's a brighter white all through here. That bright white on our that's extra bone being laid down. That's a sign of arthritis on an X-ray. So what's different in this one?
Equals in the curve.
Space.
So look at how beautiful, especially, I'm so proud of this bottom disc. I can brag for a moment. This is one of my patients. This is actually someone that you all know and love. Probably not as much as I do, but this is Dr. Steve.
Oh.
This is Dr. Steve's spine in 2014 and 2016. We just re-x-rayed him a couple months ago.
Does it create a height difference once you get your spine fixed?
It can.
Back to your normal height?
Absolutely.
Wow.
Definitely. A lot of it has to do with hydration. We have a lot of patients who actually notice they get taller under chiropractic care. But so what I want to show you is that process that we're told. If he had taken this to a medical doctor, they would say, you're stuck with it. You'll eventually need surgery. And that's it. It's part of getting older.
Has the extra bone gone away? Does
Yes.
it stand out as much?
Yes, it's not as bright white there. So it's actually the extra bone. So to say that arthritis is completely, you can't change it, it's not 100% accurate. But he has made dedicated lifestyle choices to change the way his body is working. Because when we saw this, we said, no, this is not okay for a chiropractor to have their spine, period. And beyond that, it's not okay for anyone to have in their spine if they know they have an option. They can change that. So he made a lot of lifestyle choices that were different. He stopped eating inflammatory foods. I mean, he's normal. He has a cheat every now and then, but he eats very, very well. He exercises, he moves, and he gets adjusted no less than once a week. And this is phenomenal. So we see changes like this every day. So we have an x-ray right over here. You guys can see that person's only been under care for 6 months. And we're already seeing tremendous changes. So don't listen. What's out there, just because we've been told it's true, doesn't always mean it is.
Don't blindly accept it without continuing to try.
Exactly. Research yourself, because it is possible to make positive changes. So this is one of Dr. Steve's spinal facts. Every cell, organ, tissue in the human body is controlled by your nervous system. That includes how your body breaks down and how it heals. So since your spine protects that nervous system, wouldn't it be ideal to keep it aligned with chiropractic care? Makes sense, right? Okay. Oh, that's my last one. I thought I had more x-rays to show you guys. But like I said, there's more out here. I encourage you to stop by and take a look at them because it's really exciting to see. Because not only do we see changes like we saw for Dr. Steve's spine, but we see changes where we have abnormal curvatures, where the body was going to break down prematurely, but we addressed it soon enough. and it actually reversed it.
That's wonderful.
So it's very cool. So I'm excited for all of you when you get to your anniversaries to see the changes in your own body. And keep in mind, with Dr. Steve's x-rays, that was 2 years of work. And he was definitely a late phase 2 when we did those x-rays. And so he's coming in, he's more of a phase 1 at this point, but that's 2 years. He's still a work in progress. And if you want to continue improving your health, you have to realize your health is always a work in progress. It never stops until you decide you're done. And I pray that day doesn't come until you're done taking your last breath.
Do you have a list of foods that are anti-inflammatory?
We just had a workshop on it, and I'm putting up a video because that workshop was so packed we did not have room for the camera. So we'll be putting up a video on our YouTube and Facebook page with that information. And yes, and we have a yoga, thank you. Actually, thank you so much. So we do have a local yoga instructor who is going to be coming into our office and actually teaching a yoga class. We're working on logistics with that right now, but we're really excited to have her come in and do a workshop on gratitude and yoga. Because what better way to heal than being flexible and grateful? It's exciting. All right. Woo. Well, thank you all so much for coming. I appreciate your time and attention. I'm going to maybe turn this off. I don't know how to